Again, welcome everybody to our RCMAR webinar this morning. I'm sure folks will continue to join us, but to be respectful of time and to be respectful of our panelists and to give them the most time possible to present to us, let's go ahead and get started. Again, as you're joining, if you'd like to introduce yourself in the chat and list what institution or RCMAR site you're from, that would be great. It helps us know who's in the room and helps our panelists see if they've got colleagues and friends in the audience. All right, let's get started. Next slide, Anna, please. I'm so honored to have three wonderful researchers from three different RCMAR sites with us today. We checked in as a group last week to prepare for today, and I couldn't be happier with the content of today's webinar. I'm sure you'll all find their perspective and their experiences super insightful and helpful for your own research and to get over perhaps some of the humps that you might be encountering during this time. I'll let them introduce themselves in a minute. I'd also like to acknowledge the RCMAR staff that are with us today. So Anna is on the line with us from the RCMAR Center, and we definitely couldn't conduct these sessions without her leadership, support, and patience. So thank you, Anna, for being with us today, and you'll see her name sometimes in the chat and me referring to her as she's assisting me with the webinar today. So thank you so much. Next slide. So this webinar is being brought to you by the RCMAR Coordinating Center at UCLA. As a land-grant institution, the center acknowledges our presence on the traditional and ancestral and unceded territory of the Gabrielino Tongva people. And we hope you can take a minute to acknowledge the ancestral lands that you are currently on. Next slide. Please note that we are recording the webinar today, and we will be making it available for others to view in the future. As such, the participants will be muted to reduce any interruptions or distractions. If you have comments or questions for our panelists today, please make sure to use the chat function or the Q&A function, and I will be moderating the questions for the panelists after their talk. Without further ado, I'd like to give the panelists a brief amount of time to introduce themselves in the order that they will be presenting. So we'll have Homero from the RCMAR Chime program at UCLA, Romeo Escobar from the RCMAR at the University of Texas, Rio Grande Valley, and Erica Diminich from the McFadden RCMAR. So I'll have the panelists introduce themselves briefly, and then we'll get started. Homero?
Good morning, everyone. My name is Homero del Pino. I am associated with RCMAR at UCLA. I'm an associate professor at Charles Drew University, and my PhD is actually in philosophy, and I'm excited to be here today.
Good morning, everyone. My name is Romeo Escobar, and I am at the University of Texas in Rio Grande Valley. I'm an assistant professor in the School of Social Work. So obviously, I'm a social worker by profession, and I am very delighted to be here today to share my experiences on my research that I'm conducting. Thank you. You need to unmute yourself.
Okay, is that better?
There you go, there you go.
So good morning, good afternoon. My name is Erica Diminich, and I am a research scientist via the McFadden, University of Michigan. I am a research assistant professor at Stony Brook University in the program in public health, and I'm really looking forward to today's talk. Thank you.
Excellent, thank you. I think all of our technical checks are done. I think we're good, and let's go ahead and get started. Romeo, you're on.
Are you seeing my presenter view or slides? What are you seeing?
We can see your slides.
Oh, okay. I'm using here 2 screens. All right, great. So good morning, everyone. Again, my name is Homero del Pino. I'm an associate professor at Charles Drew. My presentation today is on strategies for remote online interaction with research participants from COVID-19. So my presentation is based on my experience transitioning from doing face-to-face interviews to doing online interviews. So this is based on the experiences that I've had with my K and also with a center grant that I have at Charles Drew University. I do want to acknowledge my community partner, which is St. John's Clinic, Victor Martinez and Evan Rojas, and my team at Charles Drew, Petra Duran, Aníbal Ángeles, and Jose Hernandez. So what I will present to you is not entirely my own brainchild. It's born out of the experience of our entire research team. So my objectives for my very quick talk are that hopefully by the end of this talk, you will be able to prepare for online interviews. So I want to give you some very practical do's and don'ts on how to get through online interviews and how to prepare for that. So 2 parts, preparing for the interview and the day of the interview. So how do we prepare for an online interview? What sorts of things do we need to plan and get ready for? So I know there's been a lot of questions as to why there have been a lot of challenges that people have had around online research, wondering, how challenging is this? What's going to happen? Is it feasible? Is it doable? Et cetera. So I thought it would be interesting to bring it back to the basics. Like, why do we conduct qualitative research in the first place? Right? So we can ask ourselves, why do we conduct qualitative research in the first place? Right? And usually we do that to gain insight into the experience of our participants, to interpret data, to get guidance on where we want to go next. And so the biggest question I think we should think about when we transition from face-to-face interviews to online is, how does online data collection facilitate or interfere with these aims? Right? How radically different is it really to go online from face-to-face? So I want to do a little bit of comparing and contrasting of what we used to do before the pandemic and sort of what we do now. And again, this is what we're currently doing in our research, in our research team. So before, we would have people sign their consent forms in person, right? People would come into the office or the community center, wherever we would meet people, and they would sign their consent forms. And that's one of the biggest things that we had to change. Now, we ask our IRB for a waiver of consent, but we also send our consent forms ahead of time. So we ask people to email back consent forms. We ask people to text us that they're willing to be a part of the study. And then when we do the Zoom study, we also ask them if they're willing to participate in the study. So although we requested a waiver of consent, we're still tracking consents in three different ways throughout the study. So this is one of the changes that we've gone through. Also before, when we would conduct our studies, participants would come into the offices and they would complete the surveys, demographic questionnaires, et cetera, whatever sort of instruments you're using. And what we started doing now, because obviously people don't come into the office, is we actually email the people these questions ahead of time. We are using REDCap, which is a data collection system and data management storage, and data storage and data management. So we actually send them a link, and they complete their surveys online. So the day of the interview, there is no paperwork, quote unquote, nothing that needs to be completed, nothing that needs to get filled out. No consent forms, no surveys, no demographics. All that is completed ahead of time. And that does have some advantages. which I'll get into a little later. Something else that we used to do before COVID-19 was, people would come in and we would ask questions during the interview. And one of the suggestions that the team made that I thought was very helpful was that we send questions ahead of time, to avoid the deer caught in headlight looks. So my study in particular, I mentioned that this is coming from my experience with my K project, my K01 and my Center grant. We're looking to develop an intervention that engages siblings in the promotion of PrEP messages for Latino gay men. So we do ask questions around substance use and sexual risk, which can be uncomfortable or put people on the spot. So in order to warm people up, we send them the first 2 or 3 questions of our study just to get them warmed up so they kind of know what to expect, so that when the interview starts, they're not going in there, completely blind. They have a sense of what we're asking. So this, I found, has been extremely helpful. The first few times we did interviews, it was very, very flat. Like they were kind of awkward. We were kind of awkward, just like, hi, let me ask you these questions, because they're starting cold turkey. But by sending people some questions ahead of time, it actually helped to facilitate the process and get people a little more involved, more warmed up to us. So if anything, I highly recommend doing this if you're conducting online interviews. So again, before, the interviews were conducted in person, but now they're online. So some things that I highly recommend are doing a test run. So someone from our team would actually contact the participants a few days before the scheduled interview to do a Zoom test run to make sure, A, that they can connect, and B, that they also understood what were the expectations, right? Like what were to remind them of the appointment, to impress upon them the importance of where they're going to be and that they need to have privacy, and to remind them of the length of the interview, which is about 45 minutes, right? So we had to do a lot of groundwork before we actually had the interview. So doing a test run to make sure that they can connect. Again, we use Zoom. You may use something else, but we did do test runs with them to make sure that they were ready to connect to Zoom. So we would have as little technical difficulties as possible the day of the interview. And this is something also that had to change. Before, we would give incentives after the interview. So we would give participants $50 for sharing with us their time, their energy, and their personal data. But obviously, we can't do that anymore. So we started using Venmo and Cash App. So this is, if you haven't used these already, these are apps that we can use to send people cash, either from our accounts over to their accounts. But we didn't just ask people to get a Venmo account or to have Cash App. We actually sent them a screenshot of what the instructions were going to look like. We actually created a document to send them ahead of time. And in this document, again, we sort of highlighted like how they're going to sign up and literally walk them through the document. So simply sending participants a document, and assuming that they will fully understand it, I think is a mistake. We sort of directed them, walked them through the documents and the sorts of things that we wanted them to focus on, right? So this is sort of what I want to bring your attention to here in this slide. How to sign up, we put in arrows, again, to guide people through the process, what step they're on, right? And also give them some instructions, right? Like signing up with Facebook, might give them a shortcut, et cetera. And what I did find out through this experience was that, at least for Cash App, and I think Venmo is doing this as well, you don't need to have a bank account. So if we have participants that may not have a bank account, what some of these companies do now is they will send you a debit card with the amount that you deposit in it. So participants will be given an amount, a card from these companies. So not having a bank account is not actually an impediment. Some very quick tips, please update your routers. Something we didn't really think about. I just kept using the same router that the cable company gave me and then realized it was just not possible, not helpful. Always keep your Zoom updated, and there is a link. There are some tips on how to improve your Wi-Fi. This is really important. And the day of the interview. So I am running short on time, so I'm going to run through the remainder of my slides. The advantage of having people complete their surveys ahead of time is that you can check them for errors. So we had participants, we would ask participants, how many friends do you have? How many of them are male, how many of them are female? We had a participant say that he had 10 friends, 7 females, 5 males. So we can change, check these mistakes. Explain the project ahead of time, the day of the interview, before you start recording. So I would start recording the interview, and then in the middle of it, it would come up again like, oh, what is this again, or what is going to be done with my data? So even if your recruiter explains the project, your coordinator explains the project, the day of, they still don't understand the project, don't get recorded for it. I put #fail because my talking about the project was recorded, transcribed, and paid for. So I paid to hear myself and read myself talking to the participants about the project. And of course, let participants know when you're going to start recording. So you have to prepare participants. I would tell participants that we're actually having a conversation, not to think of this as an interview. I would let them know that I would have follow-up questions, that they're not to be seen as challenges, that no matter what they said, I would say, that's interesting, tell me more. So I would tell participants literally, if you tell me you'd like to smoke crack and have sex with 6 different men on a Saturday night, I'm going to say to you, okay, that's interesting, tell me more. If you tell me gay men should wait to get married before they have sex, I'm also going to say to you, well, that's interesting, tell me more. So participants wouldn't feel challenged if you had follow-up questions. I would let them know that I would be taking notes. So in case they saw me looking away, they wouldn't think that I was just being rude. And I would also let participants know if this is part of your study that you're going to delete the Zoom video so they know that you're not keeping their images. Let them know that it's okay to curse and model that behavior. I would curse myself. Explain to them why we use pseudonyms, a fake name. Some people are not familiar with the term. Some people don't care if people know about their private lives, but I would say to them, we care, they can't find out about you through us. And then let them know we're about to start recording. Make sure you lock the meeting and consent participants. So I will tell participants, before I start recording, I'm going to ask you, do you agree to voluntarily be a part of the study and to be recorded? And you have to say yes. So I would coach them, and then I would hit record. And also, you should prepare yourself. Your body language is always important, and whether you're slouched over or kind of relaxed when you're doing your interview. So it's not just about how participants are being, how they feel, but it's also how you feel. And it's also really important to smile, smile, smile. Smiling does make a difference and affect how participants react to you. Okay, my time is up. I just wanted to give you some quick tips on how to prepare for online interviews. I can answer more during the Q&A, and there is a longer, I do have a longer presentation that I did a few weeks ago on the CHIME, on the UCLA RCMAR website, which you can check out if you have time later. And I believe questions are at the end.
Thank you, Homero.
Or are they now?
Yes, so we'll do questions right now for you. Homero, you can feel free to put that link in the chat if you want, so folks have access to your longer presentation. Thank you so much.
Sure.
So there are a couple of questions that have come in from the participants. The first ones are really around IRB and how in the world did you get IRB approval for this kind of payment? Most institutions make it quite complicated to offer participants cash. So tell us a little bit about how you obtained IRB approval.
Sure. So I do talk about that a little bit more in the longer presentation, but IRB, there are things that, lots of changes you have to make in your IRB. With the payment in particular, this is something that my IRB pointed out, is you can set the payment status to private. So in Venmo, if you're familiar with Venmo, when people pay you, if you look on Venmo, there's a timeline of who's paying whom, like Homero paying Romeo for margaritas, last Saturday, Homero paying Erica $50 for dinner, right? So there's a way that you can set this to private. So I think letting your IRB know that you're going to pay them, that there's a way to keep this private, I think is one way to bring them along. If you have IRBs that are just dead set against it, there's nothing you can say. But if you can negotiate, I think one of the points you can make is that you can set this to private. And so no one needs to know that they participated in your study. I hope that helps.
Thank you. One more question before we go on to the next panelist. One more question, and this is around the age of your participants. So many of our scientists obviously RCMAR affiliated, are conducting research with older adults. And so there's a little bit of a challenge about changing from traditional face-to-face interviews to online interviews. So what would you recommend? Who are your participants, and how do you handle challenges for digital literacy if they don't have a computer or an iPad to do the interview?
Okay, that's a great question. So there are two different studies that I had. I mentioned my center study and my K. For my K, the participants are younger. They're pretty much all under 50. But for my center study, for my K, we do have some older adults. We asked Latino gay men to bring in a relative, not just a sibling. And so some people brought their mothers, and someone brought their 80-year-old mother. So there is a challenge with age, but it's not just an age thing, because we had some older adults and they were okay with Zoom if someone helped set them up with the Zoom. But the thing about age is also a physical capacity. So we did have a mother who was in her 80s who was part of this study. And so the son set her up on Zoom and everything was fine, but then he put earbuds in her ear. And he walked out of the room, but the earbuds weren't turned on. So we had a technical difficulty. He had to come back, turn the earbuds on, left the room, but then the volume wasn't high enough, right? So there was some loss of hearing with this particular participant. So that is a challenge. So I would say it's not just age. I would try to get a sense ahead of time of their physical capacity. And if it is generational, and I know different people have different feelings about this, you can just make it like a phone call. So even if they call in on Zoom, there needn't be a video because people are more used to phone calls. So some of us might remember years ago when we would be on these, conference calls with like 50 people on a conference call, right? And they were very challenging, but it's something that people are more familiar with. So that's my suggestion for working with older adults.
Thank you, Homero. You can ask other questions through the chat, and we'll make sure to get them to all of our panelists and offer responses to you via email. All right, let's move on to our next presenter. Romeo?
Let me stop sharing. Sorry, let me find a way to stop sharing. Oh, no. Sharing anymore. Okay.
Anna, did we lose Romeo?
I just heard him. I don't know if he's on as an attendee. I am in communication with him via text.
Okay, why don't we let's get started with Erica then. And we can come back to Romeo. Is that okay?
Yeah, in the meantime, I'll help
All right.
him out.
Okay, Erica, it's all yours.
Okay, hello, good morning. I just need 1 second to share my screen.
Erica, if you could unmute yourself.
Okay, am I unmuted now?
Yes.
Okay, great, thank you. And everyone can see my screen?
Yes.
Okay, thanks. All right, so good morning, or good afternoon again. So as I mentioned before, I am a research scientist via the MCFAD, and sorry, just having technical difficulties. Sorry, I'm having problems advancing my slides. 1 second.
I don't think you're in presentation mode.
That's my problem. I'm going to mute myself while I figure this out. Just 1 second. Sorry about that, everyone.
Erika, I can share your slides. You can cue me when you're ready for the next slide. You're muted.
Unmute yourself, and then we'll be ready. Sorry,
everyone. Okay, so as I mentioned, I am a research scientist at Stony Brook University, but I am a McFadden scientist via the University of Michigan. Anna, can we advance to the next slide, please? Okay, so I have a wonderful team of mentors, and I just wanted to first start with, of course, thanking the RCMAR Coordinating Center for inviting me this morning to this webinar, and also to acknowledge the mentors that I have via the McFadden, which is led by Drs. Christine Arjuk, Tony Antonucci, and Laura Zahodny, and also Drs. Irving Vega, Rich Gonzalez, and Noah Webster. They all support the work that I'm going to be sharing with you this morning. And I also wanted to extend, my gratitude to my initial health disparities mentor from University of Texas at the Rio Grande Valley, Dr. Francisco Fernandez, and my current mentor at Stony Brook, Dr. Sean Clouston. And I would be remiss, given the topic that we're discussing, that this is about community engagement, by not also acknowledging the partnership and the support that I have with the church administration, shown here in this photo, Father Stan and Marge Baum, the pastoral associate, where I conduct the research that I'll share with you this morning. And of course, just always gratitude to funding. Anna, next slide, please. So an outline, just a brief one of what I'll be talking about. I'm going to briefly just talk a little bit about myself, about the work that I've been developing with the help of those mentors. So I just introduced you all and some others, so you'll see in the next slide. And then I'm going to talk very briefly about COVID. No, not ready for the slide yet. Thanks. About COVID in New York. And just some of the lessons that I learned as a clinician scientist and disparities researcher, new to this space, new to this community, that I'd like to share with everyone during, approaches that I took during the pandemic. Next slide. Okay, so I received my PhD in 2016. I'm a clinical psychologist, as I mentioned, by training. My work with George Bonanno at Columbia University was really about identifying, individual predictors and trajectories of resilience in adults exposed to potentially traumatic events. Following my work my predoctoral work, I completed a postdoctoral fellowship at NYU Langone in psychiatry research, where I also then began to incorporate neuroimaging to look at the biological and emotional mechanisms that were associated with hippocampal atrophy in first episode psychosis and in treatment response. Currently, as I mentioned, I am a research assistant professor at Stony Brook. I work with Dr. Sean Clouston. I work with Dr. Clouston as part of a World Trade Center monitoring study of responders who were involved in the search and rescue efforts from 9/11. And we're examining the role of chronic post-traumatic stress with physical and cognitive aging. I am also the recipient of a diversity supplement under Dr. Clouston's R01, where I've extended that work to look at, the cognitive and emotional mechanisms underlying cognitive functioning in a cohort of Latino responders from September 11th. Next slide, please. Okay, so the work that the McFadden, my pilot, supports, which we were ready to start the weekend that the shutdown was instituted, is a project that takes place, as I mentioned, on site at a church in a neighboring Suffolk County community in Long Island. This project was a combination of collecting, it was really a feasibility pilot study to assess the efficacy and acceptability of collecting, blood on site while conducting cognitive assessments within this population of Latinos at midlife. This was also then extended with the support from the Alzheimer's Association with a foundation grant with co-mentors that are shown here, Dr. Gladys Maestri, Monica Rivera-Mint, Stacy Scott at Stony Brook, and Sean Clouston again. These projects we were looking to start these in tandem. The Alzheimer's Association study, it's a longitudinal study involving, again, several new methods, particularly a smartphone-based study that would be assessing longitudinally daily stress and emotional functioning and stress reactivity within this population. Next slide, please. So I'm going to introduce the Brentwood community to you. So Brentwood is located in Suffolk County, Long Island. It's about 60 miles from New York City. There are about 1.5 million inhabitants in Suffolk that consist of about 10 towns. The Latino population in Suffolk is about 18%. There's been a huge influx, within Suffolk County. Now, when COVID hit, sorry, Anna, if you could just press, I have props on there, yes. And again. Okay, so this is a heat map just showing you, and the dark red spot coincides with the area of Brentwood. So if you'll see right here, these are positivity rates of COVID. And you can see that the darker areas indicate areas that had the highest positivity rates. These areas were predominantly located in Latino majority communities. In New York State, we do not have positivity rates of COVID by race ethnicity, but what we did see is that my town of Brentwood, where my work is taking place, if you'll look, was particularly hard hit. With nearly 5,000 confirmed cases, and we suspect that those were severely underreported. So one of the first things that I did when the pandemic happened was I reached out to my community partners at the church. In one of our initial emails, as you can see from this direct quote, I was careful about, this wasn't about starting research, but the response that the administrator gave me was, she thought that I was reaching out to say, hey, we were supposed to start our study this weekend, when can I go back in? And her response was really, I respect everything that you've been trying to do in this community for 2 years, but, things are bad. Next slide, please. So my first thoughts were, of course, in my mind, it was, what can I do? And for me, it was really about, relying on, maintaining communication with the community, communicating with this, cadre of mentors that I have from all of these different institutions with all of these various levels of expertise, making sure that I was being mindful, respectful of the community, but also doing something more that would be helpful. So what you see here is really just a timeline representation of some of the things that I have done since March. Key was maintaining, close contact, whether it was phone calls weekly initially, or emails, and those were weekly, bi-weekly, and then monthly as the pandemic went on, with the head pastoral associate. And my mentoring team, my team of collaborators, we all agreed that putting aside the research was the important piece, and what we needed to do was we needed to be there for this community. So some of these quotes were taken directly from conversations, and I would not have had any of the insight that I gained by maintaining this constant stream of communication was critical and vital, I think, to not only maintaining ties with the community at a time, when families were just devastated, but it was also important in shaping, when possible, future research questions. So some of the things that I did, in addition to maintaining communication, I figured out, well, so what are the critical gaps right now during COVID? And of course, it was a lack of appropriate materials in Spanish. And initially, it was also not having access to needed supplies. Face masks were an issue. And can you just click, because I have a prompt. So some of the other things that I did was I reached out to not only my mentors who served as consultants, but I also reached out to funders. The Alzheimer's Association was in constant, our local Long Island chapter was in constant communication with me to see how could they help? What did the community need? They went so far as to dropping off face masks for the church because they were going through hundreds and hundreds. I learned about issues beyond what I was reading, in the media, because as we all know, our Latino communities are very heterogeneous, and the barriers and challenges that some were experiencing certainly were not going to translate to all communities and all Latinos. The other important pieces that I did was, in addition to not bringing up my research needs or not being there as a scientist, I actually invested time and went into the community. So there were a lot of food drives that were being done. I spent a day there, and as you'll see on July 8th, I received an email. She said, don't wear any nice clothes. And after working 6 hours there, I knew why. I've been hauling boxes nonstop and loading cars for 6 hours. It was some of the hardest physical work I'd ever done, but it was invaluable because I was able to engage in conversations with families that were deeply, deeply impacted by the pandemic. So this helped shape some of the answers that my mentors and collaborators and I had, which was, when is the right time to engage? How do we do this? Again, my funders were wonderfully supportive, but we also had to think about when was it okay to start with data collection? And it required patience, and it required a great deal of flexibility. And with the patients, what happened was I waited, until the church came to me and said, as I'd shown up for another event that they were doing and helping out, the head pastor came to me and said, I think now would be the right time for you to come and start this work. It also required, though, the patients, as excited as I was, I needed to make sure, as the investigator of these studies, that I could ensure the safety of my research team, and that I could also ensure the safety of participants. So I wanted to, again, re-immerse myself into the community, which meant attending masses again and getting a firsthand view of how was social distancing, being accepted in the community. And I think I'm getting a signal that
sorry to interrupt you, but I want to make sure that we have enough time for everybody to present.
Sure.
I want to encourage our participants to start asking any questions using the Q&A or using the chat so that we can up and move on to our next panel.
So if we could just go to the last slide. Nope, I'll wrap it up. Thanks. So some lessons learned that I want to share with you. It's important to maintain contact with the community. Again, put aside the research and focus on understanding how you can help your community and what their needs are. And that payback is going to come back. Become actively involved. Do anything within your ability to show that your interests are more than in just collecting data. Use your network. Don't be afraid to reach out and ask. I was surprised at the number of donations that we received by simply making requests, and remain flexible. Be flexible with changing your protocol, extending study visits, doing what I have done, which is we're setting up outdoor tents on church premises and collecting blood that way. So thank you so much. The last slide, though, I have to say a thank you just to, this is my team both at the church, both the priests, and it's also my research team who are wonderfully supportive and who will be on site with me helping with the data collection. Thanks so much.
Thank you, Erica. We're a little bit over, so I'm going to ask folks to please post your questions for Erica using the Q&A function, and if we have time at the end, we'll make sure to respond to those or ask them in the chat, and she'll respond herself. Thank you. All right, Romeo, you're on.
Okay, let's see, let me share. Oops, what happened to my slides? Oh my gosh. I don't know what happened. I apologize. I don't know what happened. I got kicked out. Now my slides are not available. So Anna, may I ask for you to share them for me, please? Okay. Okay. I am, as I mentioned earlier, I am an assistant professor at the School of Social Work at UTRGV, University of Texas, Rio Grande Valley. And I am part of the Alzheimer's Disease Research Center for Minority Aging. And I received a small grant for a pilot study, and which was funded by NIH. And of course, our principal investigator is Dr. Gladys Maestre, who has been very, very helpful in my project. Next slide. So when I submitted an application for funding, I was interested in examining or exploring the Mexican-American caregivers of people living with Alzheimer's disease in the South Texas-Mexico border. When I did my literature before my pilot study, I discovered that there's a lot of studies being done with caregivers, but they have been primarily in other parts of the US. But I was interested because we have a high, dense population of Mexican Americans in the Rio Grande Valley. I was interested to ascertain whether or not the caregiving experiences by Mexican Americans is similar to other parts of the US. Next slide, please. So I wanted to let you all know, basically, one of the reasons I wanted to give you a few statistics about our population in the Rio Grande Valley. This is the distribution of the US Hispanic population by counties. And the darker red, as you can see, are high concentrations of Hispanics within the US. You can see red spots all over the US, but more so in the Southwest states, Texas, Arizona, New Mexico, California, Utah, Colorado, and all that. And we are, next slide, please. So we are right here, right in the tip of South Texas and Mexico border. So there's a high concentration. Our population of the Rio Grande Valley, consisting of 4 counties, is 1.3 million. And Hispanics, Latinos, synonymously, we're about anywhere between 86 to 97% Hispanic population in those counties. Next slide, please. So I wanted to indicate to you by giving you basically and wondering how does it fit into my study? Well, as you notice, this is more or less when all these migrants are coming in to the US. But if you notice in the Rio Grande Valley, we have about 162 people that were apprehended and passed to the US. And, you know, they come into the US. And what's interesting enough is that a lot of these people, when they stay in the United States and they become citizens, they actually become caregivers. So I'm finding that out as I am doing my interviews with the caregivers, people that have become natural citizens, but they share their experiences about caregiving. Next slide, please. This particular slide, I wanted to let you all know in terms of the structure right now in 2020 here in the Rio Grande Valley. Basically, if you notice, there's a higher population between the ages of 0 to 30 and below. The projection in the Rio Grande Valley by 2050 is projecting that people between the ages of 65 and below is definitely going to increase. So what does that mean for the Valley? It means that there's a higher need, there's going to be a higher need for us to provide services for the elderly. And of course, we know that the elderly are more vulnerable to getting the illness or related dementias. Next slide, please. I wanted to also show you, because this is significant, here are the 4 counties in our Rio Grande Valley. And as you can tell, in Cameron County, there's about 35% individuals that have a less than 9th grade education. But Starr County has the most, 65%. That's a significant percentage of individuals because it has the lowest educational attainment in the Rio Grande Valley. Next slide. Okay, so you've seen basically the demographics of the Rio Grande Valley. It is a highly dense population with Hispanics, Latinos, Mexican Americans, however we want to call ourselves. I use those terms synonymously. So the purpose of my study was to examine, I want to explore the caregiving experiences of Mexican Americans with that work with Alzheimer's patients or related dementia in the South Texas-Mexico border. And I want to identify some of the challenges and other significant predictors of burden experienced by the caregivers with these patients, and then to explore other cultural values or beliefs that may contribute to the caregiving experiences. Next slide. So these are the three questions regarding my study. Are the cultural social aspects that impact dementia caregiving in South Texas the same as other parts in the US? And do Mexican American caregivers in the South Texas-Mexico border respond to caregiving needs in the same way as in other regions of the US? And what are some of the contributing factors that influence caregiving in this region? Next slide, please. So this is the emphasis of my talk today here, because obviously with the COVID-19, it impacted just like all the other my colleagues that have spoken before me. And so we had to change everything around. As you well know, our lives have been turned upside down by this COVID, but we will prevail and we're continuing our research. A lot of the procedures, I'm not gonna go over all of them because they're similar to what Homero was talking about in terms of how I'm conducting the interviews. But one of the biggest challenges is how am I going to disseminate the information? So what I've done to resolve that issue is holding what I consider informational sessions regarding the project with agencies, coalitions, caregiving support group meetings. And I use highly the promotoras. Promotoras are highly used here in the US Valley, the Rio Grande Valley, because promotoras are what we call community health workers. They work in the colonias. The colonias in the Rio Grande Valley are some of the most poverty-stricken areas in our Rio Grande Valley. And the promotoras are workers that go into the colonias to try and pool resources for these individuals. But the promotoras also have worked very closely with caregivers. So that has been one of my sources in terms of referrals. Because initially when I had proposed my study and I was contacting all these agencies, I was initially going to be doing focus groups, bringing in the people, of course, into the a location in working in collaboration with an agency in the Rio Grande Valley. Unfortunately, I can't do that anymore. And one of the big issue is, okay, how am I going to recruit caregivers now? We don't have a caregiver registry here in South Texas. We don't have a recruitment center. So I had to contact all these agencies and conduct these meetings to go over the research project with them to see if I could elicit some interest in participating in the research study. And I'm gradually coming in. I mean, people are coming in and calling in. After the meetings, they'll contact me I'll leave my information, and then that's how I am beginning to do my interviews. Obviously, I had to change the methodology. It's a qualitative study, but I am doing primarily telephone interviews, which presents very big challenges for me because, as similar to what Homero was doing, we're talking about a lot of people down here because of their lack of education, they may not have Zoom. So I'm having to do the interviews by telephone. So it's a challenge because when I call these caregivers, well, I have to call them 4 or 5 times before they answer my phone call. And understandably so. I mean, you know, most of us don't answer telephone calls from numbers that we don't recognize. So, but once I set up the interviews and I tell them what we're going to be doing, what I have found works a lot better is I use the term pláticas or charlas, you know, approach with the caregivers, because I want to allay some of the concerns. They're not seeing me, I'm not seeing them, so I can't see any of the body language, you know. So in order for me to begin, I have to be very careful in the selection of words to establish what I consider a therapeutic relationship with them, so that I can build the trust, so that they can trust me. They're not seeing, they're talking to a stranger on the other side of the line. So I have to be real careful. So I usually start my interviews by saying, vamos a platicar un poco. Let's talk a little about your experiences. I want to learn more from you. I want you to tell me. When I take that approach, it's sort of like an open-ended situation for them, and they'll start and they'll run with it, you know. And I don't necessarily have to be telling them, okay, well, the next question is so and so, because in their talks, they're answering the questions in the I'm using 3 instruments: spirituality, which is very important here in the Rio Grande Valley. I'm using the care burden instrument tool. And then I'm using the care giver self-assessment questionnaire. But when we do the pláticas, they're answering the questions. You know, so I don't have to necessarily have to go question by question, because we're talking. We're just chatting with one another, okay? One of the things also that helps me is that I went through that experience with my mother. So that in itself also helps break the ice, so to speak, to them, understanding what they were going through. So because I'm not unable to observe the body language when they're sharing their data, I use open-ended dialogue and use the cultural value of personalismo, which is very important in the Latino culture. That is talking about valuing the interpersonal relationship with their doctor, with a clinician, with a worker. So I am trying to establish through the telephone, I want them to feel comfortable and make that telephone call personal, allowing them to feel at ease so that we can mutually have loyalty, respect, and confidence with one another. Because you have to remember one thing, they're on the phone talking to a complete stranger. So I have to make them feel comfortable. I have to make them feel at ease so that they can open up. And they do. Once we start the plática, it goes very smooth. Interviews can last anywhere. The longest interview that I've had is an hour and 15 minutes. And I always tell them, if you feel that you have more information from me that you want to share with me, absolutely, I will give you a second interview. And at the end, I thank them. But what I have found interesting is that when I thank them, they're actually thanking me for listening, because a lot of the individuals, the caregivers that I've interviewed, they respect the idea that someone is listening to what they have gone through. And that in itself helps with the therapeutic relationship that I've established in that one phone call. And using that approach, that open-ended approach, definitely, I feel, helps me do that. And it's going slow, but it's getting there. My initial projection was to interview 60 caregivers. I'm up to 11 right now. So it's going slow, but it's coming. And what's interesting is that after I thank them that, and then they'll say, oh, you know what, I have a comadre, or I have my sister who's been a caregiver also, and all that. And so they themselves are giving me additional referrals, which is very helpful in this time. Next slide. Oh, that was the last one. That was it. Thank you so much for your time, and I apologize initially. I don't know what happened. I got kicked out of the system. That's the world of technology. Thank you so much.
Thank you so much. Thank you, Romeo. Excellent. So thank you, panelists. These were great presentations, very different approaches, different issues, but definitely all helpful, I'm sure, to those that have been listening. I want to give folks on the webinar a chance to ask their questions. So again, we're opening it up right now to all 3 of our. Feel free to ask your questions using the Q&A function or through the chat. I do believe Erica has responded to the chat question about the food drive. So Erica, I don't know if there's anything else you wanted to say about that.
Yeah, so the question had been about, how did I allocate, in my budget for, donating to the food drive that the church was doing. And in fact, I did not. Those were, private funders that had money in place for the church, although I did, secure additional funds for them, and it was by asking people. But I think the most valuable tip there, and it's something that I actually wrote into another grant that's COVID focused within this community, was it gave me great ideas for recruitment strategies and for different ways in this era that we are all trying to conduct research in, to conduct research. Seeing the hundreds and hundreds of cars and the facilities that the church actually has, it gave me the idea of, well, we can do similar drive-through research, study visits, and tagging these on to different events like that, when church members are already there.
Thank you. There's a question in the chat, and this one's for you, Romeo. How are you recording your telephone interviews?
Yes, I am using a recorder, and before I start my interview, I'll ask, and I do a brief consent, a verbal consent actually, and since it's an anonymous study, I cannot have a signed consent, but I have a verbal consent and it's being recorded. And then I transcribe all those recordings. And from there, I'm gonna have the data to analyze it.
Yeah, so just to clarify, you're using a speakerphone when you conduct the interview?
Yes, I put it on speakerphone and then I tie it into my recorder, personal recorder, and then that's how I can go back and I explain to them why I'm doing that so I can capture everything that they're saying. And I do tell them also I will be taking some notes while you are talking to me, but I do need to record it if you can give me the permission. So far, everyone has given me the verbal permission to do that, and it's recorded.
Thank you. Well, thank you so much, the three of you, for sharing your thoughts with us today. We really appreciate it. You all, we're going to show you the links to our RCMAR Coordinating Center website, but you can all reach out to these panelists using our Connect with the Scientists function on our website. Thank you so much. We will be sending out a brief survey on this webinar. We'd love to hear from you. We welcome your feedback, so please make sure to let us know how this webinar was. We do have an upcoming presentation with GSA focused on Alzheimer's disease and working with older adults and looking at cognitive outcomes, looking at improved outcomes for our populations with cognitive impairments. And lastly, we really do want you to enrich our community by joining us through our various social media platforms. Please visit our website and follow each other. This is really about building community and elevating all of our voices, about connecting with each other on this very important work that we are all doing. So thank you so much for being with us today, and we hope to see you on our next RCMAR webinar. Thank you, everybody.
Thank you. Do you want to have a debriefing of how it went?